Korean University Medical Center. He holds influential position in prestigious medical institutions. Dr. Lee is the representative director of Mirabel Skin Clinic and hold key roles at Demire and the Korea Academy of Aesthetic Dermatology and Cosmetic Surgery. He is a recognized key doctor and speaker for various organizations. Dr. Lee has also made notable contributions to medical literature, including research on cardiovascular risk factors. Please, Dr. Lee.
Thank you, Dr. Yoon. My name is Dr. Sang-Soo Lee, and today I'd like to share about the experience of using a triple wavelength diode laser, which is normally treated as a hair removal. This is how it looks. It has a two handpiece, and only one handpiece produces a 3 wavelength laser, and other handpieces makes a cool device, which makes the skin, if there is too much heat in the skin, it makes it cool. Using these 3 wavelengths, it could penetrate differently. So it could go 755 nanometer wavelengths goes the upper dermis, which 1064 nanometer wavelengths goes more deeper. The wavelength has a different absorption coefficient with the chromophore. Alexandrite laser, which has 755 nanometer diode wavelengths, which in this laser is a diode laser, and also 808 nanometer. These two wavelengths has a chromophore for the hemoglobin and also the melanin, but the NDR laser has another chromophore, it's the water. If you can see from the image that the 755 nanometer has a higher coefficient, higher absorption coefficient for the melanin, and the NDR laser has a less absorption coefficient. That means that it could penetrate more deeper because there is a less absorption from the upper layer. And also, this kind of laser has a longer pulse duration. So when we use a laser which has a long pulse duration, it makes a photothermal effect. The earlier laser, picosecond laser, it produces a photomechanical effect, so it's a different type of lasers. So when we talk about the long pulse laser, we could think about the theory which is very famous, which is produced by Russ Anderson. It's an extended theory of selective photothermolysis. The chromophore, like the melanin and the oxyhemoglobin and water, it acts as a heater, and it produces a thermal damage, and it goes to the outer part. So that's why the hair follicle actually is not a chromophore, but it could give a thermal damage to the hair follicle. This is the 3 wavelength device which produce hair removal. It's an article. It says that it gives a different level of the thermal damage, so it could give a more efficient effect, more efficient, and also a more safer. This is another article. It says this same thing, that it targets a different layer. But the one thing that I am focused is that it says a gradual heating of the dermis, and this thing causes minimal damage of the skin and also reduces the hair growth. And what I think about this sentence is that when we give a gradual heating to the dermis, we could also produce a skin tightening, like a collagen remodeling. So when the collagen has a heat thermal damage, the collagen may be destruction, and also the collagen will be remodeling. So This way we could give a skin tightening effect also. Most of the device, which is infrared light and radio frequency and ultrasound, also is popular. Those kind of devices produce thermal damage to the dermis and also the subcutaneous layer. And maybe it's the same mechanism as same mechanism as before. Then I'm going to tell you how it works. When the covalent bond of the collagen molecule is broken by a thermal damage, then it will be eliminated by the macrophage and MMP. And also, when there is a destruction of the collagen, the wound healing process will be occurred. And also the eating shell protein will be produced. That's why the collagen formation will be newly formed. So as these procedures occur, the contraction of the collagen will be appeared, but this kind of collagen contraction will be disappeared very fast. It wouldn't go like 1 year or 2 years. Maybe it would go up to months. So when the collagen retraction will occur, it will show like a lifting device, but it wouldn't go much longer. But it makes a collagen remodeling, like a regeneration, skin regeneration effect. That will go up to about 6 months. Then we can think about the temperature. How much temperature should be occurred to make a collagen remodeling? From the 42 Celsius, it will make the collagen shrinkage, but we have to make a temperature up to 60 Celsius to make a coagulation. But when we want to make a 60 Celsius, we have to aware of burn. So we could think of this Arrhenius equation. This tells us that even where you're using a low power laser device, which produces less temperature, so if we are treating like a 42 or 45 Celsius temperature, if we treat this device for a long time, then it could give an irreversible damage. So the coagulation of the collagen could be happened in a long time with a less thermal damage, less temperature. So as we said, the triple wavelength diolaser affects the different depths of the skin. As you can see, Alexandria laser has a high coefficient, absorption coefficient to the melanin, and melanin is probably placed near the basement membrane. So it will give a thermal damage, maybe like the apodermis or the epidermis, and the NDL laser could go penetrate more deeper, and it could give a thermal damage to the lower dermis or even subcutaneous tissue. And also, not just giving a treating for the skin tightening effect, 755 nanometers has a high absorption coefficient for the melanin, so it could treat for the epidermal pigment. So this is just Alexandrite long pulse laser, how the epidermal pigments have been removed. And using a 20 millisecond, 40 millisecond pulse duration, but in this article it used the higher fluence. But as I mentioned earlier, that by using an Arrhenius equation, if we use like a stacking method, we also could effect and make a epidermal pigment coagulation, epidermal pigment removal. And this is an NDL laser, which also using a 50 millisecond pulsation and using a higher fluence, it could make a skin rejuvenation. But As you can see, it used a frequency of 2 Hz and 3 pass and 1 week interval. In this parameter, if we use it, we might have some pain, but if we make the fluence a bit less, lower, and if we make the frequency a bit more higher, like 5 Hz, that means that we are shooting more shots on the skin. That will make a lesser pain and giving a nearly the same effect. So 1064 nanometer wavelength, as I mentioned earlier, it has a poor absorption to all 3 chromophores, like a melanin and oxyhemoglobin and water. That makes a deeper penetration. So maybe the diameter is like 2 millimeters depth, but it could go more than 3 millimeters deeper. So the article and like textbook says that optical penetration depth will go up to 5 to 10 millimeters. That means that layer will be the subcutaneous tissue. And also the heat diffusion, when the heat is produced, the dermis layer will be cooled very fastly, but the subcutaneous layer will be, the heat will be remain a bit longer. So in that case, the subcutaneous tissue may have an effect on other places, but I couldn't find any things about that article, and I didn't have any experience about that. So if I find it or make that experience, I will let you know afterwards. So by using this triple wavelength dilator, not even used, it's mainly used for the hair removal, but other than that, we could use for skin tightening and also for the facial contouring, like a lifting effect for the immediate effect, but it doesn't go longer. And also, it could give a skin brightening effect with the 755 nanometer wavelengths. And using a large spot size, it could make a penetration depth a bit more deeper, and also it could make more faster treatment. And this handpiece has a flathead spot, so the laser is mainly produced in the middle. And this is maybe the advantage of using this device. It could check the error, and also it could be the problem can be solved very quickly. This will be the video of the procedure. First, I used a 50 millisecond and 12 Joule for the first parameters, and also 5 Hz of this device. In that parameters, there will be no pain, but patient might feel some warm sense. So we have to tell the patient that if she feels a very much pain or very much high temperature, then she had to tell me about it so that I could stop, or I have to check about the skin burn. And I use this about 300, more than 300 shots in one area. So normally I use 300 up to 500 spots in one area. And also this handpiece has a cooling device in the skin contact area, so it makes the epidermal yes. You see the upper right side, it says 24 Celsius. That makes this the temperature getting not too high, so it could be used safely. And you see, this is the 20 millisecond pulse duration, and also I used the 7 Joule for the fluence. And in this case, I used the frequency a bit more faster, 10 hertz. So also I use 300 shots at least for one area. And this is the before and after. Just after the laser procedure, and you can see more shallower jawline. And also you can see the Marriott line. It has been subsided a little more better, and also the jawline has been more sharper. So the advantage of using this laser, it has a less pain, and also has a no downtime, and also gives immediate lifting effect. So if someone wants to take a picture, like a photograph, you could use this laser just before the day for the event, and it will make your face more sharper and more beautiful. And also, not just using for the hair removal, you could use it for the skin tightening and makes the skin more brighter. And also, there's a lots of options that makes the device very safe. And also, it has no any cartilage that I have to pay for by using it. Like Ursula, we have to buy some cartilage when we keep using it, but this device doesn't need those. So before I complete my lecture, you have to tell the patient that lifting effect doesn't go very long. So this is the important thing that patient should know, and also it needs a several treatment for a better skin tightening effect, and also the interval should be 1 or 2 months will be good. And this kind of laser produces thermal damage, so you have to be aware of the skin burns. This is I finished my lecture. Thank you for listening.
Yeah, thank you.